Okay, good morning. Today I'm going to present on fatigue, fatigue. So the definition wise, fatigue is inability to maintain required power output to continue the muscular work at a given intensity lah. So that is the definition. So what is the causes? There's few causes here. So it's about 4. So the first one, we correlate with the one I discussed previously. So which is the reduced rate of energy delivery lah. So there's ATP PCR, anaerobic glycolysis, and oxidative metabolism lah. That's the first one. The second one is accumulation of metabolic by its product lah. So which is the lactate and also the hydrogen. The third one is failure of muscle fibers, contractile mechanism lah. And the last one is alteration in neural control of the muscle contraction lah. So these 3 causes, if it is known as like a peripheral fatigue, occurs in muscle. The last one, it's known as central fatigue lah, because it occurs in brain. So pathomechanism wise, okay, what role does this energy availability play in this fatigue during exercise? So I'll talk about the first one, PCR depletion. So usually this ATP directly responsible for the energy use lah. So but will be less rapidly depleted because the PCR is there. So the backup system, like I mentioned last time, is PCR will be there, so ATP will be produced. So but in this case, as the PCR depletes, the use of ATP will still continue, and the ATP PCR system will be less able to replace it. So what will happen is that the concentration of ATP will reduce, hence it will cause exhaustion lah. So this is by the PCR depletion lah. So to delay this fatigue, usually for athletes, right, so we need a proper pacing lah. So that's why we need optimal training lah and experience for athletes. Okay, so for the glycogen depletion, rate of muscle glycogen depletion controlled by the intensity of activity. So there's this graph here actually. So if you see, the x-axis is the exercise time. So the y-axis the muscle glycogen lah. If you see, the higher the time, okay, let's say it's 3 hours, and the muscle glycogen is coming down to 25. Okay, if you see the earlier one, at the 0 hour, the muscle glycogen produced is 175. So that's the difference lah. So this one they took as a decline in a gastrocnemius calf muscle glycogen during the 3 hours of treadmill running at 70% of VO2 max. So just an example lah. So the another graph is okay, this one is exercise time about 3 hours, and you see this one, y-axis perceived exertion, so exhaustive. So in 3 hours time, so it falls into exhaustion lah. Okay, so this one is just to show you guys how the muscle glycogen depletion correlates with the exercise time lah. So glycogen depletion in different fiber types. So pattern of glycogen depletion from type 1 and type 2 fibers depend on the exercise intensity. So as I was mentioning previous topic, I was discussing about type 1, type 2, type 2A, type 2X muscle fibers, right? So type 1 is first recruited during the light exercise. So this is when the glycogen depletion will be very lower. So as muscle tension requirement increases, the type 2A will be added to workforce. So then after that, it will need depletion will be more than the type 1 lah. So then type 2X, exercise with maximal intensity. So there will be more glycogen depletion lah in type 2X. So there is depletion in different muscle groups like this, just to show you guys. So there's 3 muscles here. I differentiate with the vastus lateralis, gastrocnemius, and soleus. So what happened is that there's a difference between the level, uphill, and downhill for those 3 muscles lah. And if you see the y-axis, the glycogen used lah. So in this case, gastrocnemius is the one used highest lah. So glycogen used 75 when running uphill compared to the soleus and also the vastus lateralis. Okay, so is involved with the glycogen depletion as well lah. Okay, so muscle glycogen used in vastus lateralis, gastrocnemius, soleus muscle during the 2 hours of the level uphill and downhill, and then running on a treadmill at 70% of VO2 max lah. So the greatest glycogen use is in the gastrocnemius lah, like I was mentioning. So glycogen depletion and blood glucose, as the exercise duration increases, the liver must break down increasingly more glycogen lah. So it will supply more blood glucose. So once this liver glycogen stores limited, so the blood glucose will reduce. So what will happen is that the muscle uptake will be more than liver glucose output, so which will lead to exhaustion lah. So mechanism of fatigue with glycogen depletion. So there's certain level of muscle glycogen metabolism necessary to maintain oxidative metabolism of both carbohydrates and fats during using Krebs cycle lah. So in other words is that the rate of glycogen breakdown is needed for optimal production of reduced NADH and maintain the electron transport system now. So the another one is accumulation metabolic byproducts and fatigue. So the first one is heat, muscle temperature and fatigue lah. So when there's a high energy expenditure with exercise in heat, so there will be more heat production, so which will lead to the core temperature to increase. Okay, so when the core temperature increases, okay, it's stimulated by a secretion of epinephrine as well lah. So what will happen is that high muscle temperature, so what then it will impair the muscle function and also the muscle metabolism lah. So at the same time, when the core temperature increases, rate of carbohydrate utilization will be increased, so it will hasten the glycogen depletion lah. So the second one is lactic acid, hydrogen ions and fatigue. So byproduct of anaerobic glycolysis, the end product is lactic acid. So what will happen? Lactic acid increase with activities like short sprint in running, cycling and swimming. So when the lactic acid dissociates, it convert to lactate, so it accumulate to hydrogen. So muscle will acidify and it cause acidosis. So when acidosis happen, there will be a buffer system, which is the bicarbonate. So to minimize the hydrogen influence lah. So since it's already acidification, right? So hence the hydrogen concentration will remain low even during this most severe exercise. So pH changes affect energy production and also the muscle contraction lah. So if let's say pH is less than 6.9, what will happen? So it inhibits the action of PFK, which is the phosphofructokinase, one of the glycolytic enzyme, slowing the rate of glycolysis and also the ATP production. So the second one, if let's say the pH is 6.4, it stops the glycolysis, so reduces the ATP and causing the exhaustion. So also the hydrogen will displace calcium within fiber, interfering with coupling of the actin myosin cross bridges and reduce the muscle contractile force. So this is a graph actually lah. So if you see in the x-axis is the recovery time and the y-axis is the muscle pH. So in initial phase, the pH is 7.1 if you see, and then it drops down to further to 6.6 when the person's already almost to sprint lah. Okay, then and then at the end of it, if you see, it goes back to the pH 7.1 at the time of 35 minutes. So here actually, right, there's a changes in muscle pH during this sprint exercise and recovery lah. So there will be drastic decrease in muscle pH during the sprint, like I said, and gradual recovery to normal after the effort lah. So it will take more than 30 minutes for the pH to return to the normal pH. So 35 minutes lah for this. Okay. So neuromuscular fatigue, failure of nerve impulse transmission to the muscle fiber lah. So there is few processes. First one, reduce acetylcholine lah. So acetylcholine is a neurotransmitter that relays the nerve impulse from motor nerve to the muscle membrane. So it's an important one. And this called hyperactive cholinesterase. So which is this enzyme that breaks down this ACH more once it has relayed impulse lah. So it prevents the sufficient concentration of ACH to initiate the action potential. The third one is hypoactive cholinesterase. So allowing ACH to accumulate excessively and inhibiting the relaxation. So the fourth one is muscle fiber membrane might develop a higher threshold for stimulation by motor neurons lah. Then the fifth one, some substance might compete with ACH for receptors on muscle membrane without activating the membrane. Then the last one, potassium might leave the intracellular space of contracting muscle and reduce the membrane potential to half of its resting value lah. And hence, fatigue attributed to calcium retention within the sarcoplasmic reticulum, which would decrease the calcium availability for the muscle contraction. So last one, CNS. So what will happen if CNS plays main role in most types of fatigues lah. So limits the exercise performance as the protective mechanism. So to avoid this thing, usually if you see athletes will listen to music in order to while they are doing performance. So that is what I was mentioning was the CNS lah.